cataracts, because this seems to be something that's happening to even younger people nowadays. It used to be one that only older generations get, but now even young people are getting it. So today joining us is Dr. Mokhlisoh Binti Mohamed Apandi, and she's joining us in her role as ophthalmology consultant with the MAIWP Cataract Surgery Center at Selayang Hospital. Welcome to the studio, Doctor. An absolute pleasure having you here. How are you today?
Yes, fine. I'm happy. Thank you for inviting me.
All right, Doctor. Today we're going to be talking about your forte and cataract. This is something that we have seen, we've heard, we've definitely seen it in some of our older generations at home, because I've definitely seen it. Let's start off with cataract itself. Now, for the layman out there, what is a cataract, or what is cataract, and how does it affect vision?
Okay. To begin with, cataract is a organ in which we have in the body, is within the eye, in which we have lens in the eye. This lens particularly is a crystal in the beginning, but once it's become opaque, it's called cataract.
All right, so it's a crystal clear lens.
Yes.
But if it becomes opaque, then it becomes, then it's what we call as cataract.
Yes.
And cataract is something that happens over time.
Yes, it's a progressive.
It's a progressive.
Painless, progressive, and then it start blurring of vision.
Blurring of vision. So that is the effect that it causes. Now, what would be the main risk factors that contribute to the development of cataracts in an eye?
Okay. This cataract particularly happens in older generations. Older people. However, sometimes it can happen earlier, especially who are having other risk factors. Besides the aging, some patients like uncontrolled diabetics, uncontrolled hypertension, on some medication like steroid, they can induce cataract earlier. Even some people who are working outdoors, they're exposed to the UV lights without protection for long period of time, they can having cataract.
All right, yes. That is scary, because it seems to be just about everything out there, because even UV exposure causes cataracts.
Yes.
Right, so let's talk about, you did mention that the older generation is more prone to getting cataracts. How does aging actually impact the formation of cataracts in the eye? Okay.
Our lens basically is made up of protein. These proteins, after long periods, it become denatured, in which it causes a breakdown in the protein of material, and then it's clumped together and become opaque. So the opacity progressively presents in the eye, and then it start causing the blurry of vision.
The blurry of vision,
yes.
the blurriness of the vision. Like even some I've heard some people say that it seems like there's a fog.
Yes, sir. It appears like a foggy vision.
Foggy vision, smoky vision.
Smoky visions, and then patient appear like, just imagine when you are driving in a rainy car at night. You will see that when the moments you feel like the rain is there, you can see very clearly. When the light passing through for the front ongoing car, you can see it's a very hazy view, fuzzy, and then it's glaring, and a halos looking appearance. And then you have difficulty to move on. You can slow down your movement. All that, the symptoms like cataract.
All right, so now we have an understanding about cataract and how it is. And I was actually reading up on cataracts earlier. It seems sometimes you can, on very severe cataracts, you can even see it in the eye from outside. Like it just becomes a grey cover on their eye.
Yes, exactly. When it is a very gross one, actually from far you can see the reflection of the eye become white compared to normal people.
Ooh, looks like a zombie.
That is already the advanced cataract. But in the beginning type of cataract, you can't see that. You need a special assessment.
Yep. And once we come back, we'll talk about how the assessment is done. How is it done at your workplace as well, which is the MAIWP Cataract Surgery Center, Selayang Hospital. But right now, Doctor, we'll take a short break, and we will be right back on Health on Tracks. Today we are talking about loss in light, understanding cataracts to all our listeners out there. If you do have questions, you can send them to our YouTube or our Facebook or even our TikTok page. And if we can answer them, we'll be more than happy to do so. But right now, some music coming your way. We will be right back. Welcome back to Traxx, and today we're having a very interesting topic because our eyes is the only way that we look at the world. We don't have any other organs that allow us to visually appreciate what the world can give us, and today we are talking about one disease that could possibly take some of that away. And we are talking about understanding cataracts with Dr. Mokhlisoh, Binti Apandi, and she's an ophthalmology consultant at the MAIWP.
Pusat Cataract.
All right, I'm having trouble with that today. Cataract Surgery Center at Selayang Hospital. Right now, Doctor, behind the scenes, we are talking a lot about cataracts, some of the other things that can happen, some of the things that can and will happen. But now we come back to this. Let's talk about the common symptom of cataracts. I'm pretty sure some of our listeners out there might have the symptoms, but they don't understand what it was. But maybe you can tell them what the symptoms are.
Okay, in the beginning, patient will feel some blurry visions, in which they sometimes feel not significant. By the time along the way, they feel it start progressively painless. So they didn't notice that in the beginning. And then when they become sensitive to light, sometimes they can see double visions, or sometimes they can see halos appearance on the bright light, or sometimes they have frequent changing of glasses. That's a sign that patient already maybe having cataract.
All right. So when you say halo, right? Halo, which means even if they're wearing glasses and they look at a light, because like astigmatism, if you look at light, you see star shapes.
Yeah.
Okay, but if you have cataract, then it shows up like a circle.
Yeah, mostly right, a circle around that object.
Oh, that's so interesting.
Especially lights.
So initially, if patients do see all of this, they can already self-diagnose, right?
They can suspect.
They can suspect, not self-diagnose.
They
One diagnose have to go to
They
doctor.
have to get the screening properly. It can be other things as well.
Other things as well.
Yes.
The eyes, the windows into our soul. Now, doctor, this is something very interesting. Can cataracts develop in both eyes at the same time?
To say yes, but sometimes patient didn't aware. It is start usually a different rate. One eye at one time, then the other eye is slowly a different rate. Different have different rate of development.
So which means their left eye could start first.
Yes.
And then while that is going, and then their right eye starts, but because they were already used to blurry vision, then they don't notice.
Yeah, they didn't notice until both of the eye having the symptoms. Then they notice why suddenly my vision is not very good. At that point, they come to see us. Because it's already progressive few years back. But when they come to tell us, few months back. But actually, long time.
Cerita tipu lah tu. So the cataract progression, how long does it usually take?
It depends. Some patients with having morbidity, medical problems, they may develop earlier. That is a risk factor to enhance progression of cataract. Cataract not necessarily older generation, as I said before. People currently, we have unhealthy lifestyle.
True.
That is causing further earlier progression, enhancing the progression of the cataract.
So even obesity can also lead to...
high lipid profile, obesity, and then trauma also. Sometimes now we are moving around here, using transport here and then causing trauma, then can get cataract. Even our activity when we hit through, like shuttlecock injury, whatever, injury can cause cataract as well.
Yes, one of my friends actually got a shuttlecock hit his eye. Because for those of our listeners who don't know, shuttlecocks, when you're playing badminton, can actually move quite fast. Please don't let them hit your eye.
Yeah, be careful.
Be careful. Every sport has a risk factor to it. And now let's talk about once we come to, say, I suspect I got cataract, or Abang Zam suspect he got cataract. Abang Zam is our producer in studio today. How would an eye care professional such as yourself diagnose the cataract?
Okay, first we will ask history, signs and symptoms from patients, whether that whatever we discussed just now, and then we look at their vision. Our vital sign for the eye is vision. We check whether they're able to see well, or sometimes the impairment, they like have 612, 618, or worse, they can only see fingers or hand movement, sometimes lights only.
That is very close to full blindness.
Yes, that is already blind. Cataract blindness.
Cataract blindness.
That is the vital sign of the vision. And then we check into the slit lamp, that we have a machine, then we look into the slit lamp. From there, we also dilate the eye using dilating drop into because the lens located behind the iris. So we have to dilate the eye to see the lens, because different patterns of cataract have different symptoms. Like the dense cataract, they can see very dull view. But the earlier cataract, sometimes they progress from side of the lens. So it's progressed very late, but it's already there. Even posterior subcapsular cataract, they are actually at the posterior part of the capsule, so can't see with naked eye. So we have to see through the slit lamp. So from there, we dilate the eye, we see whether the retina function well or not. for the prognosis of the surgery, outcome of the surgery. If we remove the lens but the retina not healthy, so the vision may not be optimum after the surgery. So we have to comprehensively examine the patient's eye, then we give the counseling to the patient, and then we discuss with them decision making of the cataract surgery and type of lens they want to use.
All right. And since you mentioned that about surgery, once we come back, we'll talk about the standard treatment for cataracts and what and how is it performed. Are there any options out there other than surgery? We'll talk all about that right here on TRAXXfm. We are currently talking to Dr. Mokhlisoh, and she's an ophthalmology consultant with the Selayang Hospital Cataract Surgery Center. We will be right back. Don't go anywhere. Welcome back, James Blunt's 1973 right here on TRAXXfm. You're currently listening to Half on Traxx with me. My name is KG. We're talking about understanding cataracts with Dr. Mokhlisoh. She's an ophthalmology consultant with the Cataract Surgery Centre, Selayang Hospital. Doctor, a lot of important information you've shared with us today. But right now, let's talk about the standard treatment for cataracts and how is it performed?
Okay. If patient come early, very early stage to you, it can be conservative. Not necessarily for surgery. But in case it's the advanced cataract, the only treatment is surgery.
All right. Okay. So, yeah.
But the surgery is very simple.
Yeah, maybe you can explain that. Maybe you can
very simple, quick. Usually, if it's not difficult, not complex cataract surgery, it's very simple, quick, about 15 to 20 minutes, fast and safe. And it's not, we don't need the general anesthetic. We only give some local anesthetic, and then patient recover immediate after post-op. Some of them can see well after surgery. However, if difficult cataract surgery, because advanced cataract, so it may take few days to recover.
All right, so let's talk about the surgery itself. What is the procedure? What do you do during the surgery?
When the patient come to us, and then we give some counseling to them, they plan for surgery. When they attend to us, we already prescribe them to buy the intraocular lens prior to the surgery.
And these lenses, they're artificial?
Artificial lens. So it's not flexible. It's actually fixed power.
Okay.
When we do the test on the cataract, we have to check the power of the lens during the assessment. That's very important. And then when the surgery done, if we do a small nick insertion at the cornea, in which about 2-3 millimeter, very tiny wound. And then we insert a probe using the cataract pericoemulsification technique. And then we broken the lens into small pieces, and we suck using ultrasonic method. So, and then we remove, then we insert the intraocular lens, and then we sometimes no need to even stitch the wound because it's very small. In case the lens is very dense, very huge and hard, we cannot do that particular procedure. Then we have to do it. We have to cut open a bit bigger.
And that one you need to do stitches?
Yes, that one you have to do stitches.
It sounds so scary when you say stitches on the eyeball, but as you say, it's a risk-free operation, because I read online that this is a success rate of 98% and above.
Yes.
So I'm very surprised. But I also saw how they used to do this operation way back then when ultrasonic machines were not readily available. That was more scary. Thank God we are living in this current
That
age.
is called coaching technique. Yeah. They have to push the lens behind and then let the lens swimming back at the posterior pole of the our eyeball.
That is interesting. So interesting. I really do enjoy listening to doctors talk about their work, because they make it sound so easy, but then we'll be like, oh my God, how do they do that? All right, doctor, let's talk about the MAIWP. How do we pronounce that again?
We call MAIWP. Easier. MAIWP.
Cataract Surgery Centre.
Yeah.
All right, background about the MAIWP Cataract Surgery Centre. Now let's talk about cost of treatments and what are usually the cost of treatment?
Okay, we can divide the cost into two parts. One is hospital fees. Hospital fees, patient have to pay about 103 ringgit for the surgical fees for the cataract surgery. Okay. It's cheaper, right? Compared to the...
Yeah, I was just reading the numbers. They seem very far apart. But this is the government price.
The government price for citizen.
For citizen.
For non-citizen,
much higher,
like in the private.
Okay.
And then, however, patient have to pay for their lens, intraocular lens. That they have to go. We have to prescribe to them. Then they have to go to buy at the shop. The pharmaceuticals shop that we prescribe, and then they have to pay according to the lens type and requirement that patient want.
This one, they have multiple versions, but as doctor said earlier off air, in the government, there's only certain kind of lenses that we use.
Yes,
right?
The range, if a normal monofocal, it could be from 300 to 1,000, the normal price.
Oh, wow.
Yes. Advanced premium lens may be higher than 1,000. So, one eye, if you have for the cataract surgery only for one eye, basically in our center, less than 1,000. total up, isn't it?
Interesting.
For both eye, about 2,000.
And then you get normal vision again.
Inshallah, alhamdulillah, inshallah.
Like for instance, doctor, this one I'm just asking from the top of my head. Say for instance, I wear glasses and
Yes.
my power is at 450 and 500, right? So if in the future somehow I get cataracts, because
Okay, right.
thankfully, no, nothing
yeah.
now. But if I get it and I do lens replacement,
Okay.
do I still need to wear glasses after that?
Depends. For the modern technique currently, we do have multifocal. Multifocals mean you can see far, near, intermediate. But the measurements of the biometry have to be very fine one. And in our center, we do the limited cases only. Because this is like we do extra work for them.
This is premium service.
Yeah, premium service.
Okay.
Okay.
Understand. But go for a consult if you want to know more.
Yes, exactly.
Okay, doctor, I think we did understand a lot about understanding cataracts today. Thank you so much for joining us. Before we end, is there anything else you would like to add for our listeners?
Okay, I would like to tell all the listener outside that don't scared to come to check your eye vision if you have blurry of vision, because if it is cataract, it is treatable. Don't scared to see and get advice, because it is treatable. Once it's removed, you can see to normal vision again. So with the good vision, you can do your normal daily activity.
Understood. Okay, thank you so much, doctor, and a pleasure to have you here. As I said earlier, we hope to have you again. Let's talk maybe about glaucoma next time.
All right, but then that is not my subspecialty.
Alamak. We loved having you here today. So fun. Okay, doctor, thank you so much. Have a good day.
Thank you. Yes, thank you very much.
All right, so that was Dr. Mokhlisoh Binti Mohamed Apandi, and today we spoke about lost in light, understanding cataracts, and it's a very interesting topic. Now, if you do have any questions, please go on down to the MAIWP Cataract Surgery Center at Selayang Hospital. You can find the doctor herself, ask her for a consult, and then see what you can do, especially if you have blurry vision or you just feel like, checking your eye. Right, bye-bye. We'll see you later.